Hey, welcome to Mizzou Med. My name is Julia, and this is Bio.
Hello.
And we're both current medical students here at Mizzou.
This is the Patient-Centered Care Learning Center, also known as the PCCLC, and this is where medical students complete the first 2 years of the medical school. Come on with us, let's take a look inside.
This is the main level of the PCCLC. Right here we have the medical school admissions office where our interviews take place. And through the doors behind me we have our library and also a connection to the rest of University Hospital.
There is the outdoor seating area where students can relax, chill, and study. Now we're inside the flat classroom. This is where majority of our classes are being held. In addition, specialty interest groups and class meetings are held here too.
We have 5 large television screens around the room, so that way no matter where you're sitting, you can see the presentation. We also have microphones at every table, so that way if you need to ask a question, everyone in the room can hear you. In addition, all of our lectures are recorded, so attendance is optional. Now let's go to the small group rooms upstairs. This is the 5th floor of the PCCLC. On the 5th and 6th floors, first and second year medical students have our small group labs.
Both floors also have plenty of study spaces, lounges, and conference rooms. Now let's go take a look at some small group labs.
Hi guys. Hey.
This is one of our many PBL labs, which are on the 5th and 6th floor of the building. PBL stands for patient-based learning. In each PBL labs, we have 8 medical students and 1 facilitator.
Whenever there's something that we don't understand in a PBL case, which are real-life cases, we turn it into an objective. Everybody goes home, researches their objective, comes back the next time, and teaches the whole group what they learned. Let's listen into what they're learning.
Hi guys, so welcome to Block 3. We're going to be learning about neuro. Woo! I'll be quarterback, and so John, would you mind being scribe?
I'd love to.
And I'll be dictionarian.
Jessica, could you write down objectives and start reading?
Yeah. So, a 47-year-old male complained to his primary doctor of a funny feeling in his right lower extremity. Sometimes his legs feel numb and he experiences mild tingling. He was previously diagnosed with neuropathy.
So that's a good stopping point. Does anybody know what neuropathy means?
No,
not really.
I can look it up.
I can go write it on the board.
Every PBL lab also has a large whiteboard and a TV for use during PBL sessions or just your own studying.
Each student is provided with a space and lockers to keep their personal belongings. Each lab is also equipped with a fridge for where students can store food. And some students even elect to bring in their personal appliances.
Now that everybody has their objectives, it's time for lunch.
Yes!
Each floor has a kitchenette area, complete with a fridge, cleaning space, and microwaves.
There's also a student lounge area where you can hang out, eat, or study if you choose to.
No, you
Darn it!
How about we go downstairs and have a look at our medical students as they practice their clinical skills?
Dustin,
Yeah.
what are you doing? Aren't you supposed to be in the simulation center?
Oh my God, that's today.
Yeah.
I gotta change still.
Uh-huh.
Ah! I got it. We're good.
That's it, Dustin.
This is the Sheldon Clinical Simulation Center, or Sim Center. Here, medical students are able to practice their clinical skills.
Your encounter will begin now.
The Sim Center features many examination rooms, just like you'd see in a normal doctor's office. Our Sim Center actually hires actors in Columbia to pretend to be patients. This way, it feels more real for students, and it's a more realistic way to practice. During your first year of medical school, you'll learn how to interview patients, take a history, perform a physical examination, and more.
Each room also has one-way glass, allowing for another medical student to watch your encounter and give feedback. Each encounter is recorded, so you're able to watch yourself back and see what you did well and what you could do to improve. The Sim Center also has several high-fidelity mannequin and medical equipment to practice skills like putting in an IV, listening to heart sounds, taking blood pressure, intubation, and more. Now let's go take a look at the anatomy labs.
First-year medical students go down to the anatomy lab almost every week. Each student shares a donor with 3 other medical students. The anatomy lab features 34 tables, surgery lights, 9 TVs around the room, and a mobile camera for instructors to point out important anatomical structures. The air is replaced 15 times per hour. Right outside the anatomy lab, there are also locker rooms to change in and out of scrubs. Now let's check out a cuff gallery. This is the Health Sciences Library, which is a great place to study. They also reserve specific rooms just for medical students. In addition, the library gives us online access for free to a lot of different medical textbooks.
One of the most exciting things about medical school is match day. 4th-year medical students will gather here at the foyer to celebrate as they find out where they'll be heading to for residency.
To my right is Bryant Auditorium, where many second-year medical students will also have lecture.
Through the hallways behind me is the University Hospital. There, medical students complete the clinical rotations. Additionally, students can also visit the cafeteria for food or coffee.
Well, it's been a long day of medical school, so now it's time to enjoy some free time, which medical students do get sometimes.
We do.
Yeah. So to my left right here is the rec center where you can work out, and to my right we have our sand volleyball courts and Stankowski Field.
Thank you for joining us today. It's been a long day and we're very hungry, so we're going to go downtown and get a bite to eat. See you soon.